Turning the page now as we head into the winter and holiday season, state and local health officials have a renewed push to get as many people protected against COVID as possible. Most kids are now eligible for the vaccine and boosters are available for certain populations. And now Pfizer is asking the FDA to broaden that availability, saying its booster is 95% effective and that everyone 18 and older should get it. WCNC Charlotte's Chloe Leshner is live at the Gaston County Health Department. Chloe, what are you learning from local officials?
Hey Fred, well here in Gaston County and in Mecklenburg too, I'm told that the majority of people coming in for those booster shots are older people who we know are more vulnerable to the virus. But now health leaders are balancing the idea that those boosters could be available to more people while still trying to get those initial doses out too. It's been a consistent message since the start of the year.
We see we need to have a very high level of immunity amongst everyone in order to really see this COVID become something that we can live with. So we want to see a lot of folks get vaccinated.
That's evolved to include booster shots. Anyone who got Johnson & Johnson should get a second dose. And for now, older, vulnerable, and people at a higher risk of exposure should get a third Pfizer or Moderna shot. Pfizer is asking the FDA to amend its emergency use authorization and allow it to expand booster availability to everyone 18 and older, saying it's 95% effective. Health Secretary Dr. Mandy Cohen says younger people can assess their personal risk.
I think that could either be in your work setting or in something that you're doing in your personal life. So I think that there is some opportunity for folks to assess their own risk and to know whether or not they are at higher risk for exposure to COVID and whether or not booster is right for them.
And with 72% of adults in the state partially vaccinated and now 5 to 11-year-olds eligible for the Pfizer pediatric shot, she says getting the unvaccinated to finally take the leap is still a top priority.
You are 4 times more likely to get COVID if you are unvaccinated and 20 times more likely to die of COVID if you are unvaccinated. That means 2,000% more likely to die. I don't want any more unnecessary lost lives to COVID here in North Carolina or anywhere across the country or the globe. Now we have a safe and effective vaccine.
Dr. Cohen says at this point there is plenty of supply in the state for anybody who wants to get vaccinated. And they're also considering incentives for that newly eligible children's age group, those kids ages 5 to 11. Live in Gaston County, Chloe Leshner, WCNC Charlotte.
Chloe, thank you for that report.